Cihandite wega tha mugwanja miaraho mwega uri muhoro mureri wa Kameme TV umuthi ni tariki 3 mweri wa gathatha no agakunyita ugeni thiini wa umemerekia uyu wa ithaa rimwe gumenyithia uria bururi uregariura ari hamwe na gukumenyithia ciigi uhaguku wa ugitiri kaunti ya Nakuru o ndomwe na mathina maria makigomeire governor wa Trans Nzoia George Natembeya ni jitagwo mwora wa ndungu tonyanya bura wa musha thiini wa metha ya utauri na rujitikiria tuthie imwe kwa imwe ginyagia gikujo-ini gitu na minister wa kigina John Badi ni ateteire itua haria ministry yake kweheria indo imwe gikiro-ini kia magoti kiria gitikiritie acithondeki gucokerio mahia mao riu Badi akiuga amwe ya athondekia indo makoretwo makibora thirikari na gwitia igoti makiria ona kuri uguo Badi ni augite thirikari ni hariirie gutigirira budget ya mwaka twerekeire wa kigina ni ekirira mawoni ma muingi riu Badi agitanya kumithoma tariki 12 mweri uyu.
First of all, it should be understood that budget process, both the finance bill and the budget estimates, is a process that begins way back, or began way back last year. It's a process that takes almost 1 year, and it's begun in September. And we have been engaging at different levels, from the sectoral groups for budget estimates to the budget policy statement that was brought to Parliament or National Assembly actually Parliament in February. And then after that, then we got the budget estimates, and we got a lot of inputs from the Kenyans in various fora, from the sectoral working groups, and even after that, we still got representation. And the National Treasury has also been leading directly by engaging with Kenyans, and that also includes the finance bill, which we put out advert and asked Kenyans to bring proposals. We got proposals for various stakeholders, including Kenya Association of Manufacturers, we got from professional bodies, we got from the civil society, areas where they wanted amendments. And this we put together and made proposals to the National Assembly, which proposals are with the National Assembly. What we did was we provided even an explainer on each and every item that was provided in the bill. I also organized with my team an interview that was televised live, what we called a town hall meeting at Desa University, and you can remember that. And Kenyans asked questions for about 2-3 hours. We were engaging with Kenyans. We have since gone ahead even to engage Kenyans in radio stations, vernacular stations. We have engaged Kenyans on TV stations. There are other professionals who have also been engaging in the discussions. I would also tell you that we ran a program for almost 2 days with the one media houses that went live. Again, we also had an engagement directly with the Gen Zs using the digital media platform. And there was a day that I held a meeting with the MDs of digital media owners, 13 of them, and just engaged and discussed various provisions in the finance bill. If there is one bill or any piece of legislation that I think has enjoyed proper public participation, is both the finance bill and our budget estimates. A lot of issues have been raised, and as we speak, still the Finance Committee of the National Assembly is again engaged in public participation and public engagement. I would only say that this will culminate to the 12th June budget speech highlights, where now I will again speak to Kenyans and just expound and explain and give them an explanation of our economic outlook, give them a discussion, explain to them what is in our budget, again in summary, and also to speak to the various tax measures. But in a nutshell, you will agree with me that there are no earth-shaking tax proposals this year, even though a few people want to whip emotions here and there. But I think they have not been very successful in finding things to attack on this finance bill.
Na ucio ni minister wa kigina John Badi agithukira urito mehariria ma budget ya kifururi mwaka-ini uyu wa kigina riu reke tugukire cigie Hoguku wa ugitiri kaunti ya Nakuru kuria mĩĩrĩ ya arũme kuma kaunti ya Elgeyo Marakwet yonekanĩte na nguraro njũru na kuria moko mao marengetwo gĩcigo-inĩ ũmbunge kĩa Rongai kaunti-inĩ ya Nakuru. Kurerĩkana area ya haria ni Simon Yego na Kipiatich moragĩirwo kũndũ kũngĩ na mĩĩrĩ yao gũcoka gũteo haha.
Jana jioni tuliambiwa kwamba kuna ripoti ya wale vijana wetu walikuwa wamepotea on Friday. Kuna miili zilipatikana Mokotio na descriptions zilikuwa zinatali na zao. Sasa tukasema wacha tukuje tuangalia because we didn't know exactly maybe which mock waliletwa. Tukaanza na huko juu PGH. Hatukupata, tukakuja na hapa tukaambiwa kuna watu wawili waliletwa on Sunday. Hawana mikono, wamekatwa mikono and they seem like ni watu wamekuwa tortured sana. So we were given the opportunity ya kufeel hiyo miili and we identified kwamba ni hao watu wetu kutoka nyumbani and it is really painful.
Mwenye aliwawa ni shemeji wangu na kama familia tunalia, tunataka haki. Tunauliza tu serikali ni kinyama gani mtu akifanya makosa si apelekwe tu kotini. Sasa watu wakikatwa hivi ya kinyama haki inapatikana? Hiyo tena swali yetu kwa serikali. Tunataka tu uchunguzi ifanywe na sisi kama familia tupate haki. Ni kwa hata kama ni makosa si hata risasi ingeua, kwa nini ukate mtu mikono ufurutie mwili chini? Risasi inaweza ua mtu lakini huwezi fanya hiyo mambo yote kwa mwili ya mtu. Humanity ilienda wapi?
Kũu nĩ kaunti ya Nakuru. Tũgĩthiĩ na mbere gĩkundi kĩa atumia kuma kaunti ya Embu nĩmeyumĩrĩtie gũtetera gavana wa Embu Cecily Mbarire makiuga arĩa makoretwo makĩmwagagia marĩ na muoroto wa kũrehe ũteti wa kũgayũkania mũingĩ handũ ha kũrĩmĩra thayũ na ũrũmwe. Atumia aya nĩmarutĩte mũkana wa gũtabania mũrũrũngano nginyagia thingĩrĩ-inĩ wa iregi makĩũria Mbarire kũheo mweke wa kũruta wĩra na njĩra ya thayũ.
Thikũ igĩrĩ thutha wa gavana wa kaunti ya Embu Cecily Mbarire kwĩyumĩria agĩteta kwagagio nĩ maabitha thirikari-inĩ nene arĩa makoretwo makĩingĩrĩria ũteti kaunti-inĩ ĩno matekũmũkuruhania, gĩkundi kĩa atumia nĩmeyumĩrĩtie kũmũtetera. Matongoretio nĩ Eunice Kinyua. Atumia aya maugĩte mbara ici ciothe irongoreirie kũgayũkania mũingĩ handũ ha kũrehe ũrũmwe.
Wakome hiyo tabia, sababu sisi kama wamama tunapenda gavana sana na tunataka kufanyiwa kazi na gavana. Wasisuie gavana kutufanyia kazi na mambo ya matusi. Kama wanataka uongozi wakuje 2032 tutawapea kura. But sasa wakubalia gavana afanye kazi miaka yake 10 hizi.
Mambo ya kutusiwa na watu hatuitaki. Wale watatusi gavana wetu tutawashika hivi. Na mimi najua hata kama ni nani akitusi gavana najua sisi tutamkomesha. Tukiwa akina mama tukishikana hivi hawatatuweza.
Mbarire ũrĩa nowe mũikarĩri gĩtĩ wa kĩama kĩa UDA bũrũri-inĩ eyumĩrĩtie na kuuga gũkoretwo na mĩcemanio ya ũtukũ itanya inene arĩ kũmũthũkĩria rĩtwa, ũndũ ũrĩa atumia aya makũmithĩtie makiuga wĩra wake nĩ wĩkũranĩire kuma rĩrĩa aingĩrire wabici.
Kama mtu anataka kuitisha kiti aitisha na njia ya heshima, aitishe kiti yake achane na gavana.
Atumia aya nĩ marutĩte mũkana wa gũtabania mũrũrũngano nginyagia thingĩrĩ-inĩ wa iregi makienda mũtongoria wa bũrũri aingĩrĩre na kũrũgamia ngucanio ici.
Kiendelea kutukana ni wao wamamtukana. Tutapiga nduru, tusukue miti juu na tuende mpaka State House.
Handũ-inĩ ha Kameme TV, gĩtagwo Ngina. wa Wadiro.
Ni gatho gina wa Wadiro tugithie na mbere mutongoria wa bũrũri wa Slovenia Natasa Musar ni oreti ya Kenya gukorwo muharini wa mbere kung'ithania na ucenjia wa riera kuna mugaruruku maya no mathiete na mbere na gucũngĩria hathara nene akiaria hari university-ini wa JKUAT. Musar ni oretie kugie na ũrũmwe mbara-inĩ ya kung'ithania na ucenjia wa riera akioneka kurorakirwo ni mabũrũri ma G20 maria augĩte ni makirũkĩte hari kurekereria gasi ya carbon na kurehe mwanangĩko thĩinĩ wa thĩ. Mwandĩki witũ wa Kiambu Mathio Ndung'u thukĩire riboti ĩno ũritũ.
Bara ya kung'ethania na mogarũrũku marĩa bũrũri-inĩ na thĩinĩ wa thĩ irabatara ũrũmwe thutha wa mogarũrũku maya gũthiĩ na mbere na gũtũngia thĩ mwanangĩko mũnene, ng'aragu wagi wa mbura na ikuũ igĩthiĩ na mbere na ũkuruhanio na ũrekereria wa gasi ya carbon rĩera-inĩ. President wa bũrũri wa Slovenia Natasa Musar orotete mabũrũri marĩa makũrĩkanaga ta G20 nĩ gũthiĩ na mbere na gũthũkia rĩera, akiuga ihinda-inĩ rĩrĩ mararekereria gĩcunjĩ kĩa 40% kĩa rĩera rĩothe rĩa carbon, rĩrĩ gĩtarũ kĩa Afrika gĩothe gĩkoretwo gĩkĩrekereria gĩcunjĩ gĩa 6%
is to maintain and keep the planet Earth, as we heard from the Slovenian artist, the only one we have. There is no planet B. I will give you some statistical data. 80% of all carbon dioxide emissions are put into the air by the G20 countries. 4 European countries among them: Italy, Germany, France, and United Kingdom. 80%. Do you know how much Africa is producing in carbon dioxide emissions? 6%.
Hĩndĩ ya icera rĩake university-inĩ ya JKUAT mwena wa Juja, Musar orĩtie Kenya gũkorwo mũhari-inĩ wa mbere kũgitĩra marĩa matũrigicĩirie nĩguo kũhonokia bũrũri na njiarwa kumana na maumĩrĩra ma gũthũka kwa rĩera. Aumĩtwo thutha nĩ atongoria kĩhĩri hamwe na gavana wa Kiambu Kimani Wamatangi na mũmbunge mũrũgamĩrĩri wa atumia Kiambu Anne wa Mũratha arĩa manyitanĩire nake kuonania bata wa kũgitĩra bũrũri rungu rwa rĩera igacĩru.
We are advancing Kenya's role in data-driven climate resilience and environmental stewardship. In addition, the digital twin model we are building in partnership with Space SI, the Slovenian Ministry of Foreign and European Affairs, and the Center for International Cooperation in Science and Research, CMSR, represent a leap forward in how we understand and manage our river basin ecosystems.
Vice Chancellor wa JKUAT Victoria Gumia ikũngũĩra ũnyitanĩri wa Slovenia na university harĩ gwetha nja ya mathĩna ma rĩera. Rĩrĩ mũtongoria wa rũhonge rwa UN augĩte nĩ megũthiĩ na mbere na kũnyitanĩra na university bũrũri-inĩ bara-inĩ ĩno.
Universities are not just places for theory, but engines of practical solutions for issues that matter: water scarcity and management, climate change preparedness, agricultural planning, and disaster risk reduction. These models allow us to simulate scenarios, optimize responses, and prepare proactively, not reactively.
Handũ-inĩ ha Kameme TV kuma university-inĩ ya JKUAT mwena wa Juja, kaunti-inĩ ya Kiambu, rĩtwa rĩakwa nĩ Mathio Ndung'u wa Mbugua.
Nĩ ngatho Mathio Ndung'u. Njĩthĩ harĩa mehocagia mĩako-inĩ mwena wa Parklands gũkũ Nairobi mahota gwĩkora matarĩ na mawĩra thutha wa gĩkundi kĩa aikari gũthiĩ igoti-inĩ kũrũgamia mĩako mwena ũcio. Makĩaria na andĩki a mohoro, mbeũ njĩthĩ aya maugĩte haha nĩho makoretwo makĩmathĩra ũboco wao wa o mũthenya, na wona mũtugo wa kũrũgamia mĩako ĩno wathiĩ na mbere, aingĩ ao mahota kũhũkĩra ũici na ũhũthĩri wa ndawa cia kũrebia, makiugĩte nyingĩ cia ici irakwo nĩ hĩtũkĩtio nĩ thirikari ya kaunti, na ũguo hatirĩ gĩtũmi kĩa waki wacio kũrũgamio.
Jiunga inaitwa Parklands Association na imejiunga mwezi wa ngapi? Mwezi wa 3. Sasa zile county inapeana approval au wanakuja kusimamisha mijengo. Hiyo ni kumaanisha vijana hawatapata ajira, na vijana wakianza kuiba watapigwa risasi. Sasa zile kazi imejitokeza over mijengo 200. Hao ni vijana wangapi wameajiriwa kazi? Ni wengi. Sasa ikifungwa vijana watakula wapi? Na ndio Kenya sasa hakuna kazi hata kama umesoma.
Ukiangalia mjengo imeandika watu kama almost 300 na bado kuna wapishi wako hapa. Bata wanakuja wanataka kusimamisha mjengo, na ile mjengo wanataka kusimamisha iko na document zote. So watu waambie ni mbinu gani wanataka kutumia au kama resident association kusimamisha, because hao sio serikali Na kama ni association yetu saidia watu wetu, eri tuhakikisha tumeiangamiza, because tunajua kiini association ni kusaidia watu, sio ya mtu tumbo binafsi.
Saying that they are not compliant. Let it be known that we are not for the people who are not compliant. These people are compliant. Most of the sites here have complied. Why should the sites be closed? These people should be deregistered. It should be known that the said chair of the PRA is coming to incite people and to ask for documents. We want to know, apart from you being a chair of a residents association, who are you? Do you have the right to come and ask for documents?
Now over 200 construction sites zenye ziko hapa kwetu Parklands na zinaendelea, zimeemploy over 10,000 people kutoka hapa kwetu Parklands na kutoka pia kwa ward zingine zenye ziko karibu. Sasa association kama hizi zikikuja zisimamishe kazi, sasa ni vijana wanaenda kukaa mtaani na kesho ni wiki inaanza. Kweli tutakaa bila kazi? Kwa hivyo yangu ni kuomba mambo ya discrimination, mambo ya racism tunaikemea na kazi iendelee as long as approval ziko.
Na twake kwa kiriro kiao ni gukigwika na kurumirira mitangiko ya ihinda iraya kuri andu aige aria makoragwo na mawathe ngurani ari hamwe na wathe wa autism guku bururi-ini. Riu andu acio ni mataririe mwihoko wa kwamukira motungata ma urigitani utari na marihi wona watho uria urahitukirio wigia andu aria mari na mawathe wa mwaka uyu wanjiriria kurutithio wira. Watho ucio wendekithitie andu acio gukorwo makirigitwo hatari marihi na oho kwa guthutukanio mieke-ini ya mawira maundu-ini mothe ma muingi, undu uria anyitite mimagathiririe na njira nene. Njau wa Kinuthia ari na riboti ino kuma kaunti ya Kiambu.
Makiaria mari itura-ini ria Kiambu Kiambu hindi ya kambi ya urigiti utari marihi na guthurimwo undu umwe na wandikithia wa ciana iria cire na wathe wa autism. Anyitite maugite mari na mwihoko kumana na kuhitukio kwa watho wa mwaka wa 2025 wa kunyitirira aria mari na wathe, kuna ni megukorwo makiona motungata ma urigitani na njira huthu ta uria Nancy Njoroge murugamiriri wa mucii wa Agape Special Center aratariria.
Kuri ni gukoretwo kuna challenges hapa pale, no uria tungi encourage andu aria mena mawathe ni ati mena certificate ya disability ni mabati guthie ku register SHA, tondu that is one of the conditions. Na that is train act jero iretwo Disability Act number 4 of 2025
through our Fichua Mtoto initiative. Ni njira imwe njega ya ciana iria iri na mawathe kurutwo manyumba ni aciari yao niguo ciukio nacio ithake na ci interact na andu aya angi. Iri njira imwe ya gusocialize na tukiroraga uhoro wa inclusion.
Mwena-ini wake afitha murugamiriri wa kanjo ya andu aria mari mawathe kaunti-ini ya Kiambu Francis Kariri akiuga watho uyu wanjia kuruta wira andu aria mari na wathe ni mariheagwo motungata ma urigitani matekuriha ta uria watho ucio wathiriirie.
Nyingi iria cigukite umuthiri ni ciana nene ti ciana nini, na most of them riu marita riao ria mbere gwiko assessment agakionania hena thina tondu ri mwana uyu aturite na muciari kuma munini nginya gakinya miaka 8 9 na 10 na ndari athie gwiko assessment kana gutungatirwo thibitari-ini.
Aciari aria mari na ciana cire na mawathe nao magitariria uria makoretwo na ihinda iritu kurugamirira ngarama ya urigitani wa ciana ciao, kuona ukoretwo uri iguru makiria undu uria aingi matarahotaga gwitiria.
Tutihotaga guthie gucaria ndungihota gutiga mwana riu tondu toy wakwa nindagi kia gutungatirwo mathaa mothe, aheo irio, acenjio diaper, eko atia, koguo na ni hinya muno kuona mundu wa kumutigira na uria kumutigira marihi megukorwo mari iguru.
Gukire uguo ataramu a ugima wa mwiri maugite ni ugwati munene muciari guthie na mbere na kuiga mwana uri na wathe mucii, amu athiaga na mbere na kwihirwo ithenya-ini ria kumwethera uteithio
na mageka registration niguo ciana ici imenyeke ati itura tariri ni ciana cigana ciina mawathe na iri na mawathe mariku, akorwo ni iria category ya autism ni ikumenyeka. Koguo ciari ni metikirire kwiyumiria na ningi thirikari ingimenya atia kwina andu mena mawathe matangiuka gwika registration. Koguo ciari ni metikirite na makaigua
ritana rito
na koguo ni undu wa umenyo ucio ndamenya umuthi ni ngwenda kumenyithia aciari bata wa mwana uyu kumenyeka thina wake tene na gutangikirwo na ihenya gutwarwo thibitari ona to gwikwo assessment ta kurumbuio nigetha uteithio ria rabatara wa kuhota kwinyagutia kana gwika maundu maria agiriire kuringana na miaka yake ahote gutindikwo ni madagitari nigetha akinyanire.
Handũ-inĩ ha Kameme TV kuma kaunti-inĩ ya Kiambu, rĩtwa rĩakwa nĩ Njaũ ya Kĩnuthia.
Na tũrĩ o riboti-inĩ ĩrakuruhana na autism, aciari arĩa marĩ na ciana irĩ na thĩna wa autism nĩ matanyĩtwo kũhũthĩrio mũrigo mũritũ ũrĩa makuaga rĩrĩa maratangĩkĩra ciana icio, kuona andũ a wendi mwega nĩ manyitanĩte na kũhingũra ceceni mwena wa Nanyuki kaunti-inĩ ya Laikipia kũrĩa ciana icio iria amũkagĩra motungata matiganĩte. Kũringana na Bishop Anthony Muheria, kũhingũrwo gwa ceceni ĩno gũgũkorwo kũrĩ gwa kĩguni kũrĩ famĩlĩ iria ikoragwo na ũhoti wa gũkinyanĩria mabataro kũrĩ ciana ciao, gũkũ akĩhoya mũingĩ gũthiĩ na mbere kũnyitĩrĩra arĩa ahinyĩrĩrĩku.
Let's appreciate.
We have seen so many families unable to handle what is happening to their children, who delay in learning, who are hyper, who don't know exactly what to do, and delay in their speech. Most of those families are poor and are not being able to address the problem, and when they do, it's too expensive. So today, thanks to the generosity of many Christians and local benefactors, we have been able to put up this center here with the units that will give therapy, speech therapy, occupational therapy. We also have the biggest sensory room I think we have now in our country. And at the same time, assisting these children through hydrotherapy to become mobile, those who have mobility issues, etc.
They are seen as a burden, for instance, in the malls, in the churches. When a parent has an autistic kid that has a meltdown, the rest of us judge that parent, and it's very difficult to sort of feel the integration into our communities.
Shule mingi hazielewi na hata walimu hawaelewi hawa watoto because it's something new. Hizi therapies ni very expensive. Kwa mfano, tunalipa 2,000 for only 1 hour every week.
Na rĩu reke tũhũgũkĩre ciĩgiĩ ũgarũrũku wa ũtongoria mũtaratara-inĩ wa SHA, kũrĩa Dr. Mercy Mwangangi nĩarĩkĩtie kũingĩra wabici-inĩ arĩ ta mũrũgamĩrĩri mũnene rũhonge-inĩ rwa SHA na atanyĩtwo gũkinyanĩria mogarũrũku matiganĩte itemi-inĩ rĩa gũtigĩrĩra mũbango ũyũ wa SHA nĩ ũratangĩkĩra Kenya na njĩra ya raithi. Mwangangi araingĩra wabici-inĩ mũbango wa SHA ũgũmĩirwo nĩ mathĩna kĩhĩri, rĩu kĩbarũa kĩnene harĩ gwetha kĩhonia kĩa mathĩna maya, na ndĩramenyithio nĩ hĩndĩ ĩraruta ndũmĩrĩri yake. Reke tũthiĩ mwena ũcio tũigue nĩ marĩkũ aharĩrĩirie.
And when you have a social contract, you embed within it the principles of what we owe each other. And so, as government has invested in the last 8 months in putting together this institution that is a social contract between Kenyans and government, we then are at a point where we need to strengthen this institution and ensure that this institution does not leave any Kenyan behind. And so you may ask, what does this look like? I was really, really excited yesterday, or is it the day before, Madaraka Day, when the president launched SHA Lipa Pole Pole. That is one such instrument and tenet of this social contract that I'm talking about. It's a realization that all Kenyans need to live with dignity and need to access healthcare services. It's also pinned on the realization that our labor force in Kenya access their income in different ways. There are those of us who are salaried and therefore get deductions, and PS has been very articulate in defining that when you're constructing a social health authority, there are two key principles: pooling risk, pooling resources. So those of us who have pay slips would be doing the same in pooling risk and resources, but the president and his team recognized that there are those of us as Kenyans who have an unpredictable income, and that's the majority of us. And so then now there's a new product in the market that is geared towards those of us who have an unpredictable income, that enables us, one, to join this risk pool, and two, to be able to pay for social health authority premiums in a manner that is less stressful to your pocket. We are really excited about this new innovation, and there are many others that we shall continue rolling out to ensure that SHA is a success. The PS has challenged me on what I intend to implement in my tenure here as a CEO, and I've really thought about this over the past few weeks. What are the key things that I've heard Kenyans asking for? What are the key things that I've heard the president articulating? What are the key things that I've heard the minister saying need to be fixed? And I think the first one, I have 5 focus areas. The first one, we need to rebuild trust, but that trust needs to be rebuilt through transparency. And so what can you expect then as I implement this role? We have numerous stakeholders who we engage with as a social health authority. We have providers, we have yourselves, members of the Fourth Estate, we have Kenyans. What I will be instituting is a clear, transparent process where you're able to have clear visibility of the premiums that come into the authority, of the payouts that go into providers, but more importantly, even beyond the resources, what health outcomes are we pursuing? And PS Oluga has said it perfectly. This authority was enshrined in law to provide a framework for pursuing health outcomes in Kenya. This is not a bank where money just comes in and comes out. It is money where each shilling is aiming to get a good health outcome for Kenyans. And so then what you can expect and anticipate, particularly after I settle down within 1 month, we will be sharing with you a performance report of SHA. What has SHA done over the past 9 months? What health outcomes have we pursued? How many cases of dialysis have we paid for? How many oncology cases have we been able to support? How many mothers have been able to give birth to healthy, bouncing babies through SHA? How many cases of asthma have we dealt with? What does it look like in Kenya when we talk about TB? These are the things that this authority has been designed to do. The second focus is on primary health care. No system moves forward if it doesn't invest in primary health care services. And I'm especially grateful because the president and the members of parliament, we're currently in discussions to ensure that we have proper allocations for primary health care services. And here is a fun fact. 70% of us Kenyans actually access our services in dispensaries and health centers. 70% of us, very few of us trickle into the secondary level. And so one of the things we'll be doing in SHA, when you hear SHA, think of human-centered care, think of primary health care systems. Number 3, a shared responsibility and equity. This is a social health authority. This is not about Dr. Mwangangi. This is not about PS Oluga. This is not even about His Excellency. This is about you, the Kenyan. How do you engage with your healthcare services? How do you protect your family on a risk that you have no idea when it will strike? And so part of my work will really be to showcase to you Kenyans the entitlements that sit within SHA. And I've been surprised over the last few weeks sitting with different members of the public and realizing that many of us actually do not even know the entitlements that are right in SHA. I was sitting with a colleague and they were asking me, by the way, can I deliver with SHA? And how much will SHA pay? I was visiting a friend and they were wondering, and I was trying to convince them why they need to plug into the SHA system and pay their premiums. Then in the informal sector, they do a lot of mutumba business. And she asked me, but ni nini nitapata kwa SHA nikiingia SHA? Ni nini nitapata kwa SHA? And I had to open for her the benefits list, and she was surprised. You mean these entitlements are there? Yes, they're there, Kenyans. And really, it's a disservice that...
Na ucio ni CEO mweru wa ruhonge rwa marihi ma SHA Dr. Mercy Mwangangi agikiyukia ugiturwa giki kana wabici na gutariria maundu maria akihaririirie gwika wona akiheo matamu na anereketie kuneo matamu ma CEO na akiuga wa mbere ni gucokia mwihoko kuri Kenya ciegie SHA o undu umwe na gukorwo gikirumira mutaratara wa gutigirira ati ni mamubango uyu ni urateithia Kenya kuringana na mirimo iria igibatie gwitagikira mutaratara uyu na akiuga ati ni gukorwo agikihudira ihinda inene muno guthomithia Kenya bata wa gukigwatira mutaratara uyu na riu ndirenda tuthie riboti-ini igi na murekeri wakwa ndiwe arenda tuthie mwena uriko no kwa ndagika reke twambe tuikirie ni ngucokereria na mangi maingi.
Meme TV.
This is the comfort of a mom's hug. Nahi ni Morph expands comfort that feels just like a mom's hug. Babies play around and then, oops, Morphix ina absorb like whoop. Imagine haiwezi lick in 50 different movements. Makofi to both babies and Morphix. Renewed Morphix, ultimate quality.
Absolutely emphatic. He has done it.
Get ready for more on SuperSport, the only place to watch